Right. Welcome back, everybody, to another episode of the Twisted Wanderer podcast. I'm your host, Jack, and today I am joined by amazing lady. Can't talk today. I'm joined by the amazing Dr. Laura Glazebrook from our awesome community, Scoliosis Online, and she is a staple in the community. I've really been enjoying researching you, meeting you. So she's here. I'm going to let her introduce herself. So, Laura, go right ahead.
Thank you. I'm so happy to be here. I love chatting with my fellow scoliosis and fusion friends. I'm Laura Glazebrook. I have been a physical therapist for, oh my goodness, 12 years. That's a long time. I'm getting old. But I've had scoliosis and a spinal fusion for much longer than that. To the best of my knowledge, I don't recall having a formal diagnosis before like age 10, but I think my parents knew I had scoliosis from like a well visit when I was very young. I only got sent to an orthopedist, I think, at maybe age 10 or 11 for x-rays. And then by the time I had my 6-month follow-up, they had determined that my curve had gotten too big and I needed to get a spinal fusion like immediately. So
Wow.
yeah,
That's a lot.
at the
So
ripe old age of 11.
that's so young. So you're saying that you, so did they have to, do you have scoliosis at the time of birth? Like, do you remember that at all? Was it that, what was your curve at the age of 11?
So before surgery, it was 57 degrees.
Wow.
So I will say only because now what I do, I work with, I mean, as a PT, I only work with scoliosis at this point, pretty much scoliosis and pelvic health. But you can actually develop, so there's kind of different categories of scoliosis. So there's like the most common one that people think about is like adolescent idiopathic scoliosis, like, you know, when you hit your puberty and you get a growth spurt and then
Yeah.
you get like all of a sudden age like 12, 13, 14, you have like that's when most people are aware of it, but you can actually develop it a lot younger too. So they have what they call like early onset scoliosis. And so to my knowledge, I honestly don't think I had it when I was born. But even just so my son also has scoliosis, and I actually was able to detect it as early as I think he was 4 when I saw it.
Wow. Oh,
So
mom.
yeah, well, you know, I knew my story and I said, you know what, if I can keep him from getting to be bionic at least so early, like maybe I'll do that.
Yeah, definitely. That's really amazing. Wow. So I read a little bit, but I know it was a while ago. Do you remember what was recovery like for you at such a young age?
You know, I feel like, and after talking to a lot of people that have been in similar situations and had the surgery, it took me a really long time to process what actually happened. I feel like in some ways it was my first kind of trauma. And I think like honestly, there's always dynamics that go into when someone has something like this, right? I think even you and like anyone listening could kind of relate that scoliosis is one of these things that it just kind of happens to you and you don't really have a lot of control over it. And there's usually a lot of emotions tied up in that, even without a surgery, even without anything like that. And I think in for a lot of us, maybe we have some of that going in, and then we have this massive surgery.
Mhm.
And uh, at least in my case, I've been fused for a long time, but I don't really remember a whole lot of support before or after. You know,
Okay.
they bring you in for surgery, they check on you, kind of just do an x-ray every 6 months, and then at some point they're like, okay, bye. And you're like, eh.
What do I do?
I think my instructions basically were, okay, here's a list of things you shouldn't do. All right, go on, have a good life.
Yeah.
And so you're kind of just left to figure out what that's going to mean for you. So to answer your question though, the early recovery, I was out of school for about 6 weeks. I remember being in the hospital for several days, just being not really able to move very well on my own just because of pain.
Mhm.
I remember seeing a physical therapist because, a lot of times after a big surgery, they'll bring in a PT to come in and do just like get you up out of bed and have you do stairs and like make sure that you're able to be mobile before you go home.
Yeah.
And I think that was really my first introduction to PT as like an option. And I was like, this is actually a cool job. So
That's
in some
nice.
ways it was, yeah, that was a formative experience for me. Um, but I do remember it just, I think as far as my initial recovery, I I just kind of pushed through, went through the motions, and I had a goal of getting back to, I was a dancer. So I had this goal of like, all right, when can I get back to dance? Like, I want to go back to dance class. And so I kind of just pushed through all of that recovery and like all of the discomfort and like just the, you know, weirdness of this new spine.
Weirdness of it all. Yeah. Feeling
Yeah.
everything new. Yeah.
Yeah. And then I never really did much processing until much later. But I was like, all
Yeah.
right, this is me now.
This
It's what
is
I'm gonna
me
do.
now.
Yeah.
That's just, I just find it like, I couldn't imagine going through it at such a young age. So I just want to, wow, that's just, it's amazing. You even saw like a positive thing in that. Like you were able to see like PT was cool at that age and like it stuck with you. Like that's really, really admirable that you just were able to get through it at like a young age and then later on being able to process it all. Cause you're right. It's definitely traumatic. And I feel like that's a trend with people with spinal fusions is that we have to like fight through the trauma years later because we just didn't realize it all at the time. So
Yeah.
definitely a lot to go through. But I want to jump back because I know you said you detected your son early. Is he good now and things like that? Does he have a current? What's his degree and things?
Yeah. So it was very interesting. There is a certain amount of genetic there is some genetic link for some people with scoliosis. And so the numbers, they keep refining them over time, but it's, up to 30% of people with like parents with two parents with scoliosis, like up to 30% of them will end up with scoliosis. And I think it's maybe 10 to 15% chance if you have one parent with scoliosis. And
Wow.
so for me, that was especially because my curve developed so young and I was already specializing in scoliosis when he was younger. I had like my eye out on it. Uh,
Yeah.
because I don't hold any blame for my parents or even the physician, but I wonder if they had done something earlier, like even put me in a brace, if that would have, maybe it wouldn't have prevented me from having surgery, but maybe it could have gotten me further into my growth so that maybe I wouldn't have some of the issues that I deal with now. Um, so all of that in mind, I was watching my son, I'd watch him in the bath and just look for, okay, do I see an imbalance? And I think he was 4. And so I took him into my colleague. I was like, I can't do the assessment on my own. Like, I'm just going to bring him to my colleague. And she found a curve, and that felt like I felt a lot of emotions around that. Like
Yeah.
it almost felt like I was reliving my own diagnosis, and it was really kind of hard for me to process. I remember coming home to my husband and being like, it's my fault. He has my stupid curvy genes.
Oh no.
And I carried that for a while, and I still sometimes, I still feel some kind of way about that. But for him, luckily, we live in a metropolitan area. We live in Atlanta, close to, some good doctors and specialists. And so I got him into an orthopedist, and, we got him into a night brace. So he wears a brace at night, and
Oh,
his curve had gotten up to 22 degrees at one of his visits. But then we got him into a night brace, and I've just got him doing, he's got some of his little Schroth exercises that he'll do. And I've got him
yay.
doing a lot of like strengthening, just playing on the playground and being a kid and tumbling. And his curve, the last time we had an x-ray was down to like 13 or 12 degrees, which is,
That's
which is really good.
amazing.
Yeah. So I think
Wow.
what I'm trying to do, what I try to tell people, online or people that I work with in person, it's like really kind of that early detection can be really great. And I think the technologies that are available now for scoliosis are so much better than what maybe even was around when you and I were kids. Like
Yeah,
it keeps getting better.
it's definitely better. It's just that's really amazing. I didn't even know that they had options for just like a night brace, and the fact that his curve went down. And I just want to say it's not your fault. Because,
Oh,
I heard that and I just want to go there and sit there for a second because it's not your fault. We all, not unfortunately, we get these cards that we're dealt with, and sometimes it goes into the people we love and things like that. But that doesn't mean like the love's not there and our stories aren't as beautiful. So, you're an amazing mom and you caught it early and you decreased his curve. That's like amazing to me. I've never really heard a brace story because I was never introduced to a brace either. So to hear that, like I literally have goosebumps that it worked so well for your son, like really, really amazing. So thank you for sharing that. I love that.
thank you.
Yeah.
I think one of the things that I always tell people too, especially if you've got like a younger kid, is that there's a lot of doctors who are very much passive with like, let's just wait and see.
That's what I did. Yep.
But like even now, it kind of it drives me a little bit crazy because there's a lot of really good evidence now on scoliosis exercise and like the right type of brace and like these things that a lot of families like are willing to do, but some doctors, some medical systems, they won't even give you the option. They'll just say, okay, well, you have this degree curve, like come back in 6 months and we'll see how it is, versus being like, okay, well, here are your options, and then letting the family decide.
Decide. Yeah.
Yeah.
Why, especially from your point of view, because you are a doctor, why do you feel like there's such a gap there still? Why aren't more doctors trying to, I don't know, I guess keep learning? Because I feel like in that field we always want to keep learning. Like I myself was in medicine for a little, I'm on the different end of it now, but I just, why do you think that there's still a huge gap all these years later?
Yeah. So I will try to stay objective because I have clearly lots of feelings about it.
Okay, gotcha.
We do know objectively that so scientific research can take between 7 and 10 years to become widely like distributed amongst like the medical community.
Okay.
So I say that to give a lot of doctors the benefit of the doubt that maybe, some of these things, like some of these braces have been around for a while, but they're getting a lot more kind of data behind them now, like a lot more evidence on how effective they are. And the same thing with active treatments like, what I do. I definitely know my bias, but scoliosis specific exercise and PT can be really helpful. And so the evidence is coming out now that it's helpful not only for kids, but also for adults in like definitely getting rid of pain, keeping a curve the same, even improving a curve. I think my hope is that it's more like a lot of people, even like doctors in the medical community, I think they don't really necessarily know the options. I'm hoping is what it is.
Okay.
I also think some of the older generation of doctors are very much kind of set in, this
Either
is
way.
what we've always done. And, those braces don't work. And like just very much kind of, and I think we can all fall into that of just being very, I don't want to say close-minded, but just like,
No. I mean,
I
I could say
don't
it
know.
for you. I'm not it. But I but it's true. I think a lot of like older doctors just want to, I don't know, like that complex that they have. Some of them have it and
Mhm.
they just think they know all. But it's really, really, even in my job that I do now, I've been like, I'm in the medicine, but I'm on the other end of it and I get phone calls and I talk to people. And a lot of people with scoliosis I've had like call in the last few weeks, and I assess their scoliosis to see it's like a volunteer donor registry. Um, and I assess their scoliosis, and so many people just say, "Oh, I don't know. I was diagnosed when I was 13, and not much came from it." And I just like I want to ask so much more, but like that's not my job. Like, but I'm just like, there's so many people out. Like, I at least had 4 people last week that have scoliosis and just never did anything about it, don't know anything about it, and it's scary to me because so many people out there might need surgery down the line and had no idea. Like, it might come as a shock to them because they just thought, oh, scoliosis. Like, it's a big deal. I don't know why people get this diagnosis and just like brush it off your shoulders. Just
Yeah. I mean, I clearly, I was just in my Instagram stories yesterday, kind of venting about sometimes like I'll have pediatricians that, you know, in where I practice in Georgia, we need like a signed plan of care to be as a PT. Like I can see somebody for like 8 visits without a doctor's signature. But, you know, if I want to continue seeing someone, I need to have a signed plan of care. And this week I actually got a doctor who just she wouldn't sign it. And she said, I do not recommend PT, and faxed back an unsigned plan of care. And honestly, for me, again, understanding my bias.
yeah,
But I think I fall on the side of I want people to know everything about their own body, and I want them to be able to make the choice for themselves without having someone like blackball them, you know?
exactly. Like
Um,
informed consent. Like, just
yes.
like, yeah, make a good decision for yourself. Have all the information, even if you
Right.
don't want to use it.
Yeah, and I feel like every time I see somebody like when I evaluate somebody in person or like even on Instagram, like every time I educate someone, there's like this beautiful light bulb moment where it's like somebody can understand their own body better and like they have this appreciation for like, oh yeah, that makes a lot of sense. And like no one's ever explained it to me like that before. And I feel like we live a little bit in this system where so many of us can feel like disempowered and like not in control of what's happening in our own bodies. And I feel like sometimes we just need some agency brought back into our lives, whether it's through hopefully like, a healthcare professional or someone that can be, or like even someone that's having the same, like what you're doing with your podcast, like just
Yeah.
sharing experiences and being like, you're not alone. And this is what's happening and this is why. And there's something beautiful in that.
Thank you. I love that. It's true. It's just, I think I think we're both doing what we can. The more you just keep talking about it and just, like you're doing, I can't talk today. Like just connecting with more people and just spreading awareness is really all we can do.
Yeah.
Something I want to ask you is I'm really taken back by not taken back, but I'm like just impressed of the strength. Like I know Teresa also had children with spinal fusion, and I know you have. So I kind of want to dive into that. I myself do not want children, but I know I probably have plenty of listeners who do and maybe are curious and maybe afraid because of having a spinal fusion. Can
Mm.
you talk about that and like I guess make it more like in my eyes, I find it so scary. So I guess for anyone out there who might feel the same way, who wants children and has a spinal fusion, you touch on that a little.
Oh, absolutely. I I think that just like everybody with scoliosis and fusion, everyone has a very different experience. Some people have a very positive story behind like a very healing story around like their fusion, and some people don't. And I think it's very similar with like if somebody wants to have a family. I think it's always honestly, I think it's always going to be scary because like pregnancy and like childbirth, they just sound daunting even without something like rods in your spine. Like it's
Yeah, yeah. The whole thing
um
scares me.
it's
I'm one of those.
yes. I think that it's this process that like as women or people with female organs, we are built to be able to do it. So it's something that is is natural, but honestly, like it is very foreign, and it can just feel scary because it's like there are a lot of unknowns. So I think
Yeah.
that that's kind of where we all start in the first place. And I think there's unfortunately there it's usually one of the two extremes. Like either there's no information that somebody can find on it, which is pretty scary. That's where I was, I guess, gosh, 8 years ago now. Ooh, almost 9 years, when I was
Oh,
trying to start my family. I'm telling you, I'm getting
oh,
old. It's happening. But I think there's that, but also on the flip side, just as much like some of these like especially I think Facebook is pretty guilty of it, and Reddit, like a lot of people are sharing like negative experiences.
saw that on Reddit too.
Uh,
Yeah.
and so people are going in and like scrounging for information. And usually it's one of those two extremes. They can't find anything helpful, or it's like they see someone's horror story of, X, Y, and Z happened during my pregnancy, or some doctor told me this terrible thing about trying to get pregnant. And there's just not a lot of helpful, useful stuff out there.
Okay.
So one of my missions, one of the things that I'm trying to do, like with my really niche specialties,
Yeah. Sure.
because I've been in, like, I've had pelvic health training for even before scoliosis. So I have like almost 8 years of that. And then now I have the 3 years of scoliosis training. Plus
Oh, okay,
I've
cool.
carried two babies, right? So
Yeah. You
it's
got the
super niche.
experience.
Yeah. So like one of my missions now is I like on Instagram, I'm always talking about like the things you need to know. And like, yes, you can get pregnant. Yes, you can carry a baby. Yes, you can deliver a baby with scoliosis, spinal fusion. Here's what you can expect. And I try to just come at it from like just kind of science and, like a little bit more objectively, and trying to just get rid of all of the fear-based, because there's
Yeah.
so much fear-based information, and it's just honestly very uh, overwhelming.
Yeah, definitely. I feel like that's what like all I found because my spinal fusion will be 8 years ago this September. And
Happy
I just
almost
remember,
spine birthday.
yay! uh, but like it was the same thing. I was Googling and all I found was like horror stories. I'm like, oh my God. And that's like really that's when the first idea of the Twisted Wanderer started. But it was even with it, like writing back then, like Instagram wasn't what it used to be. The community is huge now. Like it's insane. So it's nice to know that like we were both searching for answers and now we've kind of decided we had the answers and now we're giving them to others. So that's really cool that you found like you're also started that journey because there was no information for you. So I just
Yeah.
let's see, no more positive. But that the fear thing really is just it gets me. Like I just find it like amazing because birth is already such like this amazing, like miraculous process. And then you're telling me that you can be strong enough and do it with a bionic spine is just like, I think it's just pretty badass, even more badass than it already was. So it's just so
Yeah.
cool.
Yeah.
Um,
I think it's honestly like I never had anyone tell me I couldn't do it, on the one hand. And I
so
think I think that also plays into it as well. Like I think some people go into it and just don't even consider the fact that they have a spinal fusion. And then there's others, but like, yes, I think we just, anytime, like if there can be more support available for people, like why not just give them the option?
yeah, definitely. Okay. So I have another question that comes to mind because you've had your fusion for 26 years.
Yep.
How do you, I guess someone who's only had theirs for like going on 8, does it, no, like, how does it feel being that long now fused? Like, how do you feel each year, like the longer it goes on. Because on I don't know how anyone else feels, but for me, I get like nervous the more I age. But
Hmm.
I'm also an anxiety person. I have like a lot of things up here. Um, so I guess like that's my question. Like, how does it get more comfortable? How do you feel having it for so long?
That is a fantastic question. I of course, I think it is something I do believe in all of us. There is always a little bit of, maybe fear is a strong word, but like anxiety about what's happening to our bodies as we age.
Yeah.
And honestly, it's something that I do talk about in therapy with my therapist. Um, Honestly, so my correction that I got back in 97, the options were not as advanced as they are now. They didn't get a super great correction. I mean, people can find me on Instagram. I still have a lot of asymmetry, because they were only able to correct so much. And so every once in a while, I do debate, like, should I try to see if I can get someone to revise what I have? Just I do worry about the segments above and below my fusion a little bit.
Okay.
But at the same time, I vacillate back and forth a little bit. Um, because I also feel like our bodies are much more resilient and capable than we give them credit for. Um, and honestly, the work, like the fusion that has been placed into my body and into your body, they are stable and solid and strong. So those aren't going anywhere. I don't, it's really very rare that anything happens within the fusion.
Okay.
So I have, this might be a bit graphic, I don't know.
No, you're
My
good.
colleague, my colleague likes to tell people with a fusion, like, you could get hit by a Mack truck and your fusion would be just fine. Because
Well, that makes
you're
me feel better because that's
right.
all I think about when I'm driving. So,
I know, yeah. And so she makes that point of like, that is stable and secure. And also it's protecting that part of your spine from getting, more twisty, right? It's protecting
yeah.
your spine from curving more or getting into a worse scoliosis within that part of your spine. Um, I think for me, I think it's probably pretty normal for, I mean, everybody, certainly those of us with fusions, with any bionic anything,
Yeah.
to kind of worry about the future. I think for me, what I try to do, and this is what I tell everyone anyway, but the more we can keep our bodies healthy, like the better. So for me, I try to manage, of course, again, realizing my bias, but I try to stay very active. I try to do like my own scoliosis corrections to, build the strength of my muscles that support my spine and to try to make sure that those joints above and below the fusion are healthy and mobile and strong. And I do a lot of work. Are you familiar with Carrie Green on Instagram?
Yes. Very good.
Um, she does a lot of great work too around just kind of resiliency within the nervous system. And one of my favorite kind of mantras that I've adopted actually came from her. And she says, like, my body is healing all the time. With that kind of not assumption, with that understanding that you can continue to get healthier like as you get older. And so you don't have to choose to just let your body degrade. You can continue to heal yourself regardless of your age, regardless of what's going on in your body. You can heal yourself. And I think that has been really helpful for me. And it
Yeah, that's a
helps
great
me,
way.
yeah, it helps me
Yeah,
get
to look
rid of that fear.
that like fear because that's true. Like you're in control of, yeah, like you're in control of like, like you said, like doing PT and your corrective work, even if it's just like 5 minutes a day, like it's
Mhm.
better than nothing. Like that makes me feel better. Because that's really all I don't know. I guess like as more years pass, you're like, wow, this is like literally gonna be in me forever.
Yeah. But I
I
think
guess
it's
like
just
that's
like,
what I'm realizing. I'm like, okay.
but I think too, it's like you can choose to eat. Like it's so similar with anything else in your body. Like your body will be healthier if you choose to like eat a salad or drink a smoothie than if you're going to go to McDonald's and just order like fast food every day for the next 10
Yeah,
years. Like your body can be as healthy as you allow it to be. So I think that's one thing that I try to keep in mind when especially if I get into I think it's normal to get into those places every once in a while where you just like, you get down into that little spiral, or maybe somebody makes a
yeah.
comment and you just like you spiral. And I think that happens to
I
all of
agree.
us.
I think it's true. But like things like today and like that being like I love everyone and like just seeing more people pop up and just more people with scoliosis and spinal fusions has been really helpful mentally to just like be like, okay, I'm gonna be okay. I'm not the only one with one of these, and we're all like you said, we all can go down that spiral, but we are in control of what we can control. And if we know that everything is stable and it's not going anywhere, then what we can do is just eat good and exercise and try and support that the best. And that's the journey I'm on. I've not always been my best caretaker of my spine. I've been pretty bad.
But you can turn it around is the
I
amazing
guess
thing. It sounds like you already have,
I have a
which
little
is
bit. It's
admirable.
you what?
I
Sorry, I
said
didn't
it's
mean to.
admirable.
Oh, thanks, Laura. It's just yeah, that's right. Anybody listening, if you haven't started taking care of yourself yet, you still can. There's time.
Yes.
Um, what I want to ooh, what did I want to ask you? I already asked you that. What did I want to? Oh, um, I was reading online about so if with bone density, you
Yes.
wrote about that on your website. Is that like I guess is that a good way to see if one would get osteoporosis? Is like that test, is that involved in that test?
So yeah, I think one of the things that we do know about scoliosis, especially as we get older, is if we have osteoporosis or more brittle or more fragile bones, we are at more of a risk of issues within our spine, right?
Okay.
So it could be just bone loss at some segments of the spine or like fracture. Um, and so it's just one of those things, especially for women. We have a little bit more of a risk than men because after menopause, we lose a lot of those protective hormones, like our estrogen kind of plummets, our testosterone, our progesterone. Like there's a lot of hormone changes that happen. And if we're not, if we haven't built the habits and, worked on our bone density beforehand, it just gets a lot harder. And you can see a big change in your, spinal health, in your posture that, if we develop those things. So
Okay.
yeah, like one of the things that I like to inform people about, and again, I try not to do it from like a fear mongering perspective, but I think it's important for people to know that our bone density peaks in our mid 30s. And here's a huge asterisk, like if we don't do anything to combat it, then we lose, a percentage of muscle strength over like the next couple of years. And that just, of course, gets bigger as we age if we're not doing something to combat that. So like exercise, cardio, resistance training, those types of things.
Wow. I didn't know that. Wait, want to make sure I comprehended that. So I'm asking it again. What did you say about the mid 30s with the bone? It
So
gets
our bone density is at its peak in our mid 30s. So like on our muscle mass as well is usually those two, they work together. Because if you think about like our muscles, they're pulling on our bones, right? And so every time we do like a resistance training workout, or we do something to strengthen our bodies, the force of that muscle pulling on the bone, like that's what encourages those cells in your bone to make more bone. Does that make sense?
I did not know that.
Oh, well, today you
So
learned.
cool.
Yeah, so every time you do like a strength workout, or every time you work your body, sometimes you get like soreness in your muscles or whatever.
Mhm.
There's this awesome thing. I had a professor in undergrad in exercise physiology, and he said all of the cool things that you feel when you're doing like exercise is your body's response of trying not to let you kill it again. Like like the body, when you're doing like exercise, your body basically thinks of it as a threat. And so it's trying to build itself up so that it's stronger the next time it has that same demand. Does that make
My
sense?
mind just like, that's so cool. That's a really cool way to like, I know it's good for us, but to actually hear like it and what it does like specifically out loud in that way is just
Yeah.
like really, really cool. That was awesome.
Yeah.
Ah, I need to start working out more. I'm
I
doing the
mean,
mace. I like the mace. Recently,
yes,
the
I
mace.
need to
That's
buy
really cool.
one. I need to buy one.
I need to, and then you do, how often a day do you do your corrective exercises?
So usually I aim to do at least 10 minutes a day. And I will be honest, there are some days that I don't do it for various reasons. So right now I'm in a very chaotic stage of life. Like I'm working full time. I have two young kids. They all like they have activities. I'm trying to like maintain a home, and I'm
Yeah, that's
trying
a
to
lot.
like maintain a marriage. So it's like sometimes I'm just tired and I don't want to do it.
I agree.
um,
Yep.
but I think because I try to like practice what I preach, and because I spend all day talking to like patients and like people on the internet about like keeping our body strong, I try to like invest a couple minutes, either like getting on the floor or like doing some stretches, like holding onto the bars, or I try to incorporate the like my corrections into what I'm doing for like fitness. And so I think about it almost like a savings account. Like, I have like the spine savings account for like
I love
retirement.
that. So
So I
awesome.
think, can I invest 10 minutes every day to put something in my spinal savings account? Um, and also at the same time, I don't beat myself up if I don't. Like I aim to do it, but if I miss a day, I'm trying not to beat myself up about it.
Yeah. I think that's something I'm working on too. Like in therapy as well. Like the shame. Shame is my enemy. I'm
Yeah.
not gonna beat myself up. Like as long as you're trying your best and be trying to be better than you were yesterday, like that's all we can do, really. Like
Yeah.
I love that. I love the savings account. I'm gonna do that.
Feel free and maybe give it a catchier name. I keep trying to like name it something, and I haven't come up with anything yet. So if you think of something there, let me know because I might
I
steal it.
will, but that's so cute. I love it. I love that.
Yeah.
All right. And then my one that kind of want to end on, what advice would you give to those listening who have an upcoming surgery?
Like a fusion, like a spine
Yeah.
surgery. Yeah.
Yeah. Anyone out there who's has a spinal fusion coming up, any type of spine surgery, what would be your
Mm.
advice for
My advice would be to surround yourselves with people just like Jack, with people who have done the thing and who have come out on the other side and are thriving and are doing great and are making history for themselves. And I think I would love to just encourage people to, if you have time before your surgery and you can do a little work on your mental health, or you can invest a little time into strengthening your body or something to get you into a good place before the surgery, if it's an option, um, or even just to speak some like it sounds super granola and woo woo, but I'm kind of there. So we're just going to let it go. Just to speak some healing over yourself and to just give your body that permission to know that this is going to be helpful and it's going to give you stability and it's going to help your body to be the strongest version of itself. And it may bring up some feelings and it may bring up some hardship a little bit, but that you're going to come out stronger on the other side and that you are certainly, certainly not alone. There are so many of us and we're all just a DM or an email away.
I love that. That was really good advice. I
Oh,
appreciate that so much.
thank you.
Hey, well, before we end, I want you to shout out all of where you can find Laura. She's gonna tell you where you can find her. She's amazing. Dr. Laura, where can everybody find you?
I am most active on Instagram. So I am at laura.g.dpt. I also have a website where I'm working on blogs, like all things scoliosis and pelvic health. And I have a couple of like online webinars and things for people that are wanting to get pregnant. So just some informational stuff available for purchase. And that website is www.drdrlaura, Laura, Glazebrook.com. So that's me.
I do love that website. It's a great website. It has really awesome blogs on there. But
thank you
so much for coming on here today. It was so much fun. And then guys, you could find me at, I changed my handle. I no longer have an underscore. So I'm just the Twisted Wanderer on Instagram. I'm so excited. I finally got my name back. Someone had it.
Get your name back. I love that.
Right. But yes, I'll see you all in the next episode.